I'm extremely delighted again to be here at this Wajir Referral Hospital together with our chief guest, Dr. Adesh, and the governor for Wajir to make and mark this occasion of the Cancer Day on the 4th of February. This is a worldwide awareness day where we celebrate the survivors and we make an awareness of this condition that has lived with us for many years. And for one thing that is quite clear, Wajir is known to have the highest number of cancer cases, of various cancers. In the past, it was thought to be having only throat cancer, and that has been the most common. The esophagus cancer has been there for quite a long time, and the stomach cancer has been there. It was attributed mainly, maybe research was not done, but it was thought basically it's a result of the high water chemicals in this water. The water table is too high. The water is also very hard. It is highly contaminated because of the high water table. So it's assumed for that matter that has been a significant contribution because of the high contaminated water in Wajir town. The other thing is the poor sanitation in also Wajir town is attributed most of the disease conditions which are there. But hopefully with the devolution and hopefully with the increased awareness of number of these conditions, particularly on the hygiene, hopefully most of these conditions will eventually be reduced. But today, as we mark this one, it is to create awareness for the various conditions of cancer that exist, particularly cervical cancer, the prostate cancer for aged men and for aged men, and particularly for those who are above 40, 50, and the regular thing they should be able to do. And for breast cancer, for those things, and it is attributed and said clearly, early detection, early detection, early detection. For most of these conditions, for you to survive longer, for you to handle and manage these cases, early detection is good. So creation of awareness, particularly for these cases, and doing a regular testing on annual basis is the most important thing for us to survive this condition. And I think there's a need for us to sensitize every family who lives in Wajir. The best thing is early detection, do a lot of screening, is available. The government, through the universal health care, has also managed to give, particularly the most vulnerable people, the NHIF card. In its endeavor as a nation, as a government, to provide the universal health care through the NHIF for those who are being covered, those who are in gainful employment like the county government and even the public service, they have an automatic cover through the NHIF. And for those and for other schemes. But for those public who also subscribe to NHIF, it is able to provide some support in terms of the screening and in terms of the medical care that subsequently follow the infection of this. So basically, the most important thing is for us to sensitize the need to have an NHIF cover, to do early detection, so that we can reduce the impact on the effects of these conditions that are there. So basically today, we are sensitizing my constituents, we are sensitizing our people who have been so much affected. Finally, I want to speak on the Ministry of Health. Thank you, the county government, for making elaborate changes in instituting a dream team to make and effect the necessary changes. I'm really applauding you for making that changes, for effectively trying to reorganize the management and the leadership of the county referral hospital, and for that part of the Ministry of Health. Thank you, your leadership, for appointing the CEC, for appointing the 2 able PSs, whom I know and has been a public demand for them to be placed appropriately so that they can be able to rejuvenate the performance of the health, which image has been defected for quite a long time. So thank you very much for changes which has been done through the leadership of Honorable Mukhtar, and I'm really thankful. Changes have already indicated there are certain results that are coming on. What I've been hearing today, there's the oncology department with the consultant here there, with 8 personnel, a fully fledged consultant. There's the rhinology department, which is functional. The electricity, which has always been a lagging problem, has been there. The oxygen plant, hopefully, is also working. So what I can see is light at the end of the tunnel. So I will applaud you for making the necessary changes. May God bless you. Let us please all endeavor to help the people of Wajir. Let us endeavor honestly and to provide selfless service to these mothers, to these women, to these young men, to these old men who only know Wajir Referral Hospital.